we're back to the Ruth Werner slides. Um, Chronic fatigue syndrome is known by a lot of different things, and it's it's a syndrome. So it's not a specific disease, but it's a result uh, of a combination of factors. Uh, it's unexplained fatigue of greater than 6 months duration. Okay, it's sometimes called, as it says here, chronic fatigue and immunodysfunction syndrome, because a lot of these people get immunosuppressed, and that's why we're doing it in this section. Myalgic encephalomyelitis is another fancy name for it. Sometimes it's called neuromyasthenia. The yuppie flu, neuroasthenia, are all names that it goes by. But mostly we just call it chronic fatigue syndrome. This is not new. It's been going on for a long time. It's probably got the name yuppie flu because upper middle class people were the ones that were seeking treatment for it, rather than uh, real working class people just figured they were tired because they're tired, I guess. Um, it seems to strike everybody. The demographic is all over the map. We don't really know who it is. It says um, it's higher in women, members of minority group. It's now saying that it's now being defined, like your book on page 112 says it's being seen more in working class people. So what causes it? The etiology is all over the place, and there's all kinds of hypotheses as to what causes it. They thought it was a viral infection for the longest time. We used to call it Epstein-Barr, chronic Epstein-Barr virus, because of the because that seemed to be a pattern. It could be any sort of infectious agent, stressful event, some sort of dysfunction in nervous system or endocrine system, or both. Uh, there probably is multiple factors to give to this. They thought it was maybe sleep problems. They thought it was there was personality things and psychological processes that added to it. Um, it's a difficult thing to categorize, and I think that it got put in the immune system category here because a lot of people with chronic fatigue syndrome have immune system anomalies. But there's no, not everybody ends up with an Epstein-Barr infection. It doesn't seem to be a necessary precursor. Um, it, in the textbook on page 113, it says inactivity in childhood and inactivity after mononucleosis have been found to increase the risk of it. It says 3/4 of individuals with disorder have reported an infection, such as a cold, flu-like illness, or mono as the trigger. Now they're looking at Lyme disease, that kind of thing. So it's all over the map. I know that's inherently unsatisfying to students, but the correct thing is that we really don't know yet. There are definitely central nervous system factors that it looks like there's something between the hypothalamus, which releases the releasing hormones, the pituitary, which releases the trophic hormones, and the adrenal gland, which releases the steroid hormones, the corticosteroids, for things like cortisol, which affects blood sugar and energy levels. It increases that, and and maybe aldosterone, things like that. So that's a big function. These people don't necessarily have that whole thing in order. And there's some dysfunction that all ends up being, whether it's the hypothalamus, the pituitary, or the adrenal gland itself, leads to low levels of cortisol, and therefore blood sugar issues and things like that. There is hypotension. These people have very low blood pressure, and it's neurally mediated. So they get what's called orthostatic hypotension, dizziness if they stand up quickly. And that may have something to do with the adrenal glands. And there could be some sort of problem with neurotransmitters, perhaps serotonin, perhaps dopamine. Again, these are all perhapses. Not everybody with it has that. So it's really defined as a fatigue that's not restored by sleep or rest, and it has to be 6 months or more in duration. And then on top of that requirement, you need at least 4 off the list: poor short-term memory, sore throat, muscle or joint pain, poor sleep, poor concentration, enlarged lymph nodes, new types of headaches, post-exertional pain after you do something. So if you're not getting restored by sleep and you have a sore throat, poor sleep, and poor concentration, you're probably not going to get diagnosed unless you can come up with that 4th thing, poor short-term memory or something like that. Really, sore throat, fever, muscle pain, and muscle weakness are the most common things. We're going to get into the poor sleep a little bit later, because there's a real overlap between chronic fatigue syndrome and fibromyalgia. You're going to see that poor sleep, muscle and joint pain, post-exertional pain are all products of, or all things that we see in fibromyalgia when we get there. So there are theories that say that chronic fatigue and fibromyalgia are 2 sides of the same coin. It's just, how does it manifest? And there's a lot to be said for that theory. A lot of these people have irritable bowel syndrome, depression, anxiety. Again, this is a very hard thing to diagnose because it looks similar to other things, and there are so few like pathognomonic sort of signs. They all have to be kind of, it just adds up to make the diagnosis. And you can imagine that that's anxiety producing, and that's depressing, and so you get a kind of a chicken and egg syndrome. Like, are you depressed because you're in pain and you're tired and you're not diagnosed properly, or are you in pain and not sleeping properly, etc., because you're depressed? A very difficult thing, and it's one of these syndromes that not every doctor is on board with. Not all doctors believe that the syndrome actually exists, so they're reluctant to make that diagnosis. So what do we do with these people? Stress will add to it, because stress requires more cortisol. That's the stress hormone, and these people have low cortisol, so they don't cope with stress very well. they have to make lifestyle choices about exertion and about trying to get enough rest, etc. You got to be very careful with alcohol and drugs, various stimulants. The exercise that they get has to be very measured because of the post-exertional stress. So it has to be kind of slow. Like things like yoga and Tai Chi are probably better than hitting the gym hard, that kind of thing. So so they need to learn more about nutrition, about that kind of thing, um, and just help with management. A lot of these people really have trouble having anybody believe that, including family members, that this is going on. Because, frankly, they bitch about it for years, maybe, for definitely months, and before they get any sort of help or any sort of possibility of diagnosis. The minimum is 6 months. So it's a difficult, it's just a difficult thing to for these people to deal with. Massage helps them because it stimulates parasympathetic responses. It helps relax. It relieves muscle pain and joint pain, and so you can work on a lot of the symptoms, but you can't get rid of the syndrome.